A cadaveric renal transplant refers to a kidney transplant where the donated organ comes from a deceased donor. Here are the key aspects of a cadaveric renal transplant. Types of cadaveric donors. 1. Donation after brain death, DBD. The donor is declared brain dead, but their heart is still beating, maintaining organ perfusion. 2. Donation after circulatory death, DCD. The donor's heart has stopped beating, and death is declared before organ retrieval. Indications. 1. End-stage renal disease, ESRD, due to diabetes mellitus, hypertension, chronic glomerulonephritis, polycystic kidney disease. 2. Renal failure due to autoimmune diseases or congenital abnormalities. Steps in cadaveric renal transplantation. 1. Donor selection, identification of a deceased donor, assessment of kidney function and viability, screening for infections, malignancies, or contraindications. 2. Recipient preparation, medical evaluation, including cross-matching and tissue typing. Preoperative optimization of health, e.g., infection control, dialysis, administration of immunosuppressive medications pre-transplant. 3. Surgical procedure. The donor kidney is surgically transplanted into the iliac fossa of the recipient. Vascular anastomosis is performed, connecting the renal artery and vein to the recipient's iliac vessels. Ureteroneocystostomy is done to attach the donor ureter to the bladder. 4. Postoperative care, monitoring for graft function using serum creatinine and urine output. Immunosuppression therapy to prevent rejection. Management of complications like infection, thrombosis, or delayed graft function. Complications. 1. Immediate, hyperacute rejection, vascular thrombosis or leakage, bleeding. 2. Early, acute rejection, urinary complications, e.g., obstruction, leakage, infections. 3. Late, chronic rejection, recurrence of primary renal disease, malignancy due to prolonged immunosuppression. Outcomes. Success rates are generally high, with advancements in surgical techniques and immunosuppression. Graft survival rates are approximately 1 year, 90 to 95%, 5 years, 70 to 80%. Cadaveric transplants remain vital to addressing the shortage of organs for patients with ESRD.